Osteoarthritis. What is osteoarthritis and what are the symptoms?
Osteoarthritis is a very intense condition where affecting the knee joint. It causing the cartilage to be wear out and then getting thinner. Because of the cartilage getting thinner, so the both bone end will rub in each other and causing pain, redness, inflammation, and then at the late stage of the disease, it may cause the deformity of the knee joint.
What causes osteoarthritis and who is most at risk?
Causes of osteoarthritis is essentially multifactorial. It means there's a lot of factors affecting the disease. Commonly affecting the disease is usually overweight, increasing of weight, age, rise in the family, repetitive stress, trauma. Sometimes secondary causes like rheumatoid arthritis, gout, or infection causes also can lead to osteoarthritis.
How can we prevent osteoarthritis?
Osteoarthritis can be prevented by living a healthy lifestyle, avoid injury, avoid repetitive stress to the joint, and of course, if you get a symptom, need to seek treatment earlier.
What are the treatments for osteoarthritis?
The treatment for osteoarthritis can be divided into surgical treatment and non-surgical treatment. Of course, in the initial part of the disease, we will try non-surgical treatment. Number one is to treat the pain. So during painful periods, we can use a painkiller. Other than painkillers, we can reduce the swellings, like putting ice pack during acute pain. Patient will have to advise to modify activities like avoid stress activities like squatting, staircase, and then may have to choose a low impact exercise. Example like bicycle, swimming. Of course, when you go to about surgical treatment, number one, of course, is arthroscopic surgery. This is a keyhole surgery to debride the joints and improve the swelling, improve the inflammation, improve the pain. And followed by, if it's not improved, then we can do osteotomy. Osteotomy means cutting certain part of the bone to adjust back the alignment, to offload the arthritic part. But this surgery is mainly for a younger patient. After that, if it's not getting better, then we have another option is to get the total knee replacement. Means we replace the joint surface with a metal, and between the metal there's a plastic, so it's called a total knee replacement surgery. Sometimes it can be total, it can be partial. So these are options available for the treatment for osteoarthritis.